So, on a scale of 1 to 10, how weird is this for you?
Not too weird.
Here's why it doesn't feel weird to me. First of all, I'm no longer your patient.
Right.
So there's
Let
no
the record
weirdness.
stand.
Yeah, let the record show that I'm not her patient for the best reason. I'm in remission and I've been in remission, and sorry, but I don't need you anymore.
Don't need me anymore. That's
your job
the
is
goal.
done here.
That is the goal.
But I did think, like, is this weird? Because it's truly not for me. Because partly, I feel like you were such an instrumental part of my healing, and it's precisely because it wasn't because of your white coat. It was because you were so kind. When you're that low and that depressed, kindness goes a long, long way. And also, our missions are aligned. I've become a patient advocate with my website. I want to be able to get more people to seriously consider ketamine therapy, because I've been where they are, and I know it's a really dark place. I am so grateful.
I'm so grateful for you. I mean, this is very surreal for me. It feels like something that I wish could happen more often, but because of that precious boundary between doctor, patient, a lot of times we don't get to talk so candidly, or we don't get to be so comfortable and casual about it, but because you graduated out of the practice, we can have a different type of conversation.
Is that what it is now?
I don't know, or whatever you want to say.
I'm graduating.
Left us. You didn't need us, which is what we want for everybody. I mean, and I think you developed these tools and these insights over time that really you didn't need much more. You were your own healer. And I think that's a part of ketamine that is so different from the other types of treatments that we do in the world of psychiatry, where you're really tapping into this inner healing wisdom that you innately have.
A lot of our conversations were almost philosophical.
Yeah, because I think ketamine kind of crosses that boundary of sure, it's a medication, technically, right? But the way it works in healing, you can't really explain that based on just a mechanism of action, right? We still don't totally understand how ketamine works. There's so much faith. I think you have to put a lot of faith in the process and in yourself. And you were really brave and just dove in and were willing to go places that not everybody feels safe enough or comfortable enough to go, because it's uncharted territory, that going into the mind.
What I really appreciated was that you made it your business to come into the room, and we had long conversations that were extremely helpful to me, because I think one of the things that really confused me was that I didn't understand what ketamine was. And so the idea that, I was coming to a clinic, I didn't know any of it. So, it takes a certain amount of guidance to be able to do that. It was just one of those things, because it's just not well known. That's part of the reason I wanted to start my website and become a patient advocate, is because I think most people have absolutely no idea what this entails. I think that I had an enormous amount of psychedelic visions.
Yeah, and I would say I think you had more than most people, which is always so fun for me to get to hear about, and educational as well, because not everybody has visions when they're doing ketamine or Spravato. So to have that, I feel is a real gift. And I want to hear about this.
And the thing is, this is actually one of the questions that I wanted to ask you, is how much of the healing comes from the drug itself, the molecule, the mechanism of action, the biology, how much of it is it psychology? Because when I went through these visions, to me, they were instrumental in my healing.
Yeah.
And I honestly don't even understand how it could be otherwise, because it was so emotional and so I could feel things shifting because of it. So it's like, so my question is, it's more like philosophical almost, like, is it psychology or biology that's creating the healing?
Yeah, I don't think we know definitively the answer to that. We have, you know, studies, and we have some things to lean on, and anecdotal things. So it's kind of like almost like the nature versus nurture. That's like a very different type of question, but probably it's both. There was a study that came out recently where they took patients who had depression. They were planning to go under surgery for another reason, like some medical reason. And during the surgery, they gave them ketamine on top of the anesthesia that they were already planning to get.
Because why not?
Right. I mean, so they gave them, you know, a pretty, you know, a dose of ketamine on top of it. But during the surgery, they're unconscious, okay? And then the other half of the patients who had depression didn't get the ketamine, underwent the surgery as usual. They showed no difference in the outcomes in terms of their depression, after, you know, based on whether or not you got ketamine or no ketamine. Nobody got any better in terms of their depression. That was really surprising. We thought, I think the authors, you know, leading up to that study really thought like those who were getting the ketamine were going to get better, because there were a lot of anecdotal stories about people who did have treatment-resistant depression, who got ketamine in surgery, and their depression was cured for the first time.
Was that how it was discovered?
Yeah, and that's part
first?
of like what led to the discovery of it.
Yeah.
But, and so the studies may be a little confounding. Maybe there were some anesthesia interactions between the ketamine and the anesthesia that the patient was already getting. But that study did kind of lean towards like the importance of, maybe there is an importance of being conscious during the treatment. Maybe psychologically it really does matter to have that kind of experience with the dissociative quality of it versus just being completely unconscious or like in that kind of anesthetic, deep anesthetic state.
That's so interesting.
Yeah, so that's what they were trying to kind of get at it in terms of that study. So that study would lean towards probably, yes, there probably is something important maybe about the spiritual or the psychological experience of like interacting with the ketamine. Then we have people who do Spravato who never dissociate at all, ever. Like they just, for whatever reason, no matter if they're at 56 milligrams or 84 milligrams, they feel totally the same in the room with the treatment. And I have seen many of those patients get fully in remission of their depression for the first time in their lives. And it's kind of one of those, you have to see it to believe it. But talking to other docs in the field that also work with Spravato, they've seen the same thing. So they're, maybe with S-ketamine at least, you don't have to dissociate to get better. Now, I do think the dissociative part of it can be very healing, and maybe some people have, maybe there's like psychological barriers that prevent people from dissociating. And there's a whole body of literature about that. Like there's maybe subconscious defenses that prevent people from, you know, allowing themselves to go into those states. Maybe people don't feel safe enough, right, to dissociate. I like to think that we create a safe space in our clinic where people can do that, but you know, there might be needs that we're not meeting all the time. But I do think it's always really brave when someone can kind of let go and surrender into the treatment and explore those parts of the mind and do that kind of healing that you just really can't do on a day-to-day basis, like without like that kind of like catalyst.
Well,
so I personally believe that it's nice that like you don't have to have it to heal your depression, but if you're going to like make meaningful changes about how you perceive your life and about how you perceive the things that have happened to you, I think the dissociative part can be very helpful. And I think you're like living proof of that.
Yeah, because to me, that is what created the healing.
And I totally believe you on
because, like one of the things that happened to me, and I realized that just because it happened to me doesn't make it universal, right? But I have talked to enough people, particularly guys, I don't know why, but I cried so much during the whole process. And it was really painful, really painful. And yet, because somebody was asking me, well, that doesn't sound like something I'd want to
Sure.
do.
Yeah.
And I said, well, when I say painful, I mean painful as a stepping stone to healing.
Mm-hmm.
And I said to this person, you know what's really painful? Depression.
Yeah. Yeah.
You know what's really painful is hopelessness and despair.
Yeah.
And I will take the crying any day, because at least I felt something.
Right. So, right.
Because that was
Right.
a lot of depression was just like, you know, like I was using Adderall to work and Klonopin to sleep and alcohol to fill in the gaps, and my bedroom became the outer perimeter of my social life, you know, like my world was getting smaller and smaller and smaller. And then I was taking these SSRIs, and all they did was, you know, the thing about SSRIs that just kills me, and I tell this people all the time, it helped. But what it helped is that it helped me stop digging.
Oh, interesting. Yeah.
The problem is I was already 50 feet deep.
Mm-hmm. Mm-hmm.
It helped me stop digging.
Yeah, like the bottom.
But I couldn't figure out a way to get out.
Yeah. Yeah.
You know, and that's one of the things that I actually wanted to bring this up to you, because I have this thing with SSRIs that I've had terrible experiences with them.
Yeah.
And I know that when I talk to people that they've pretty much had pretty bad experiences too. And this, to me, the ketamine is something that is just so completely outside of what we understand as an antidepressant treatment.
Yeah.
I just was, I had a certain amount of resentfulness towards SSRIs, because while they stopped me from digging, there was no ladder out.
Yeah. Yeah.
You know what I'm saying? And to me, ketamine didn't just like stop me from digging, it got me out of the hole completely.
Yeah.
And so I think there's like a qualitative difference that, to me, is that and I'm a civilian, I know you know this better than I do, but it feels to me like we are at the cusp of revolutionizing mental health treatments, because we are so used to the idea of managing symptoms rather than freeing ourselves from depression. And I just feel like I went through years of managing, and then I went through a few months and I got free of it. And so, you know, like, I kind of wanted to ask you this, because I know as a clinician, you can't say the things that I can say, right?
Well,
like, because I'm going to tell you, you ended my depression. And I know that you can't say that. I know that's not.
I think you ended your depression.
Yeah.
With the help of ketamine.
Yeah. And I still remember you saying, oh, this reminds me too. Do you remember the day you told me I was in remission? I just thought this was really funny. She tells me, and I burst out crying. And I looked over.
I was like, oh no, I said that.
And I think he misunderstood what I was
maybe he doesn't know
saying.
what I mean by
Right.
like it sounded like way worse than it was.
Do you remember that?
Yes.
Like, I remember it.
Because I was startled.
And the reason it's funny to me, because I realized as I was crying that I thought, oh my God, she thinks like I'm taking this as bad news. It's not. It's not that you were telling me something I didn't know.
No, I know. Yeah.
You know what it was? It was this. It was somebody in a white coat telling me what I already knew. And for some reason, it was so validating to me.
Oh, I'm glad that,
Do you know what I'm saying?
Yeah.
Like,
well, I think
it was a real moment for me. A real moment for me.
I remember that moment well. That is definitely like one of the joys of my job, is being able to celebrate that with people. And I think a lot of times when people are in remission for the first, like a lot of times it is the first time, unfortunately, that someone is in remission of their depression. It's something to definitely celebrate. I think sometimes there's a lot of like apprehension about it. Like it can be hard to like articulate like I'm better, because there a lot of times is a lot of fear, or like people feel unsure that like, well, how long is this going to last, or how long will I stay well? If I say it out loud, am I going to ruin everything?
Yes.
I like to say it out loud because I get
is
that.
Is it a placebo effect?
Right. Is this real?
Right.
And then like what can I expect? And it is real. And then there's a lot of growth that happens too with being well, right? And like being freed from the depression. That doesn't mean that life is necessarily easy. A lot of times people are wrestling with a lot of the things that they put off because they were depressed, right? And so there can be a lot of anxiety and things that come up for people as they get better that they're now dealing with. But I also think that's just like a beautiful like growth phase of people's recovery. But these are the kind of conversations that I think are just so important to have as people get well. There can be like apprehension about getting well because it's the fear of the unknown, even if it's a good thing, right? Like, or we're heading in the right direction. But I also think it's worth celebrating and taking that moment to like acknowledge like all the work that was done to get there.
You know, I was confused about something that I kind of wanted you to clarify for me, because I don't quite know what to make of it. And that's that my scores were getting better and better.
Yeah.
And just so whoever's watching this knows that every time you do a ketamine session, you do a real quick depression anxiety thing. So, well, I don't know how you scored it. It was very clear to me that I was, from 5+, or I think 5 was like the highest, and I was like consistently to the right of 5, and suddenly I was like 4s and 3s, and this is my question to you. But I didn't feel any better, and I didn't understand how can my scores be going down. I actually at one point started going like, well, maybe I'm not doing this right, because I don't feel better, but my scores are going down.
Yeah. That's really common.
Am I just stupid? Or
no, that's so common. So
why?
Okay. Well, so depression isn't just emotion, right? Depression is a constellation of symptoms. They say like there's probably like 500 different like versions of depression. If you like, I'm sure there's more. Maybe like 2,000, right? Like if you clustered all the different like symptom types, depression can look really different for different people. So it's not just how you feel internally, but it might be like, how are you sleeping? How's your energy level? How's your motivation? And so some of these things can feel subtle, and some people might not associate them with like depression, but they fit in that category. A lot of times they are subtle, and change even with ketamine, we say it's like this rapid acting antidepressant, which it is, but still sometimes when you're in that lived space and you're going through your day to day, it's not like one day I'm super in the dumps, and then literally the next day it's like the start, like everything's better. A lot of times it is a little bit more gradual than that, and so sometimes it's hard to perceive changes when it's a little bit more gradual. I do think there's like this like threshold though at some point where the changes are really building, and then it's almost like undeniable that someone starts to feel better. Everybody has their own process, right? Like some people's sleep gets better first. A lot of times like the somatic symptoms like get better first, like the sleep and the energy might get better before like the interest, like that anhedonia like really shifts. But everybody's a little bit different in how they start to heal.
No, I think I understand what you're saying.
I think that's very normal to not have that realization.
Because in other words, like things could be getting better, like my sleep, my eating and all that, but
you might still
my emotion may not.
Yeah, you might still be feeling shut down or kind of numb or.
Okay.
Yeah.
Okay, that makes sense.
But hopefully it snowballs and like at some point you're like, yeah, this is real.
Okay,
Like this
and
is,
here's-
I'm really feeling it inside now. It's not just these other things.
I shouldn't be laughing. This is about depression. We should be like, but to me, like one of the funniest things that happened, but only looking back at it, is that so I'm filling out these things, and at this point, this is past what we're talking about, and I'm realizing like, oh no, I'm feeling a lot better, and I was starting to put twos in there, like I was, and all of a sudden, I got really scared because I thought, the insurance company is going to cut me off.
I remember.
Do
this
you remember that?
conversation.
And
Yes, I remember this
I
conversation.
started lying on my. I did, because I thought they're going to cut me off. They're going to say I'm getting better. You don't
need this anymore.
I don't need this anymore.
Yeah.
And I remember going to you and,
Yeah.
and saying to you,
I forgot about that, but now I'm remembering that conversation.
Kind of like
A lot of people have that
lying.
concern because, and it's a worth having a conversation about, because when you get better, but you need to stay better, and that's the goal, right? Ketamine is it's not very durable. It's not that long lasting. It is a maintenance type of treatment for most people that have like chronic depression. So it's meant to be, if it's Spravato, you're coming in every week or every other week usually. With IV ketamine, you might be coming in once a month or every 6 weeks. It just depends. And you do really have to kind of keep that pace up to keep your symptoms in remission. There's a study called the SUSTAIN-3 trial where they looked at patients who've been on Spravato for like at least 5 years. They took a lot of them off of the Spravato, and within 6 weeks, many of them, like the majority of them, actually started to have recurrence of their depression symptoms. And that was really important to know, that the treatment actually keeps people well. And so we expect that, and if you're being consistent with treatment, we expect that you will stay well, and we actually want to show that. And so it's actually a good thing if you can show insurance that you're being, you're adhering to the treatment plan, you're doing your Spravato treatments, and you're staying well and healthy. And so actually those low scores are a good thing.
Right, because I remember you saying, no, you don't understand. If you don't show at least a 50% improvement,
right,
that's when they're going to cut you off.
Insurance gets upset if you're not.
Right,
Yeah,
and
really
then I was
cutting
like,
your scores in half.
okay, I'll just take this back to where it was.
But the good thing was that you really were feeling better. At first, if I'm remembering right, and correct me if I'm wrong, like you said earlier, it was painful. Like some of the treatments were very challenging. There was a lot of tears, there was grieving, there was imagery that was hard. Fortunately, like you were really like doing a lot of good work in terms of like processing and journaling and like contemplating like, well, what might this mean, and really like paying attention to it. But it wasn't like, my perception was it wasn't like within like a couple treatments that you were like, yeah, I'm great, like I'm feeling so much better. It was more of a journey. Like, so at what point did you start to feel like the treatments were really helping you in terms of your depression? Did you know early on, or how many treatments in do you think it was? What was, and then how did you know?
You're going to laugh.
Besides the rating scales.
No, it was not the rating
I know,
scales.
I don't think it was. And it's not for most people. Like,
I swear to you, this is what it was. I had come to one of the sessions, and I was getting ready, and there was a little mirror, and I looked in the mirror, and I went like this to myself, and I thought, Jesus Christ, I shaved. Oh my God, I showered. Oh my God, I'm wearing like nice clothes. Because the thing was, I used to show up like I was homeless.
not true.
Well, no, but I mean,
none
I
of us
was
would have known, but-
unshowered, unshaved.
Oh.
I didn't care.
Mm.
I didn't care. And all of a sudden, I cared. I cared about how I looked coming here.
I remember that.
And
Yeah.
it was, this sounds really stupid, but shocking is too strong a word. But I was just like, what the hell happened to me?
Like it just kind of automatically.
Because it
happening.
was
Like,
just
normal.
so, I didn't think about it.
Yeah.
It was like, and I realized, oh, that's how I used to be.
Yeah.
I used to care.
Yeah.
How I
Yeah.
showed up in the world.
Yeah. I remember you talking about that.
Yeah.
It was really
So
profound.
it was
Yeah.
really subtle.
Mm.
very, very subtle. It was not like, you know, I busted out of a cave.
Yeah. I think that's really important to know, because I think that's how it is for most people, that it starts out kind of subtle. And that's hard, because if you read about ketamine, sometimes in the lay press, it sounds like you're going to see unicorns and like fireworks are going to be going off during your first treatment. You're going to leave and you're going to be healed. And sometimes that happens. I have seen that happen. But most people, it's going to take several treatments and some time to like build that momentum. It's like a cumulative effect of the treatment.
And you know, I did want to talk about the psychedelic visions just a bit, because there's a part of it that I know sometimes when I talk about it, because it was painful for me, that I also want to make it clear that it was never ever unbearable. Like, because I don't want people to be scared off thinking that, you know, and I wanted to ask you, like, this weird thing with ketamine where even in the most, you know, nightmarish ones I had, like, I would be three people. Like, I remember I had this vision of me being a sort of serial killer, hating me and burying myself with an air pipe, you know, like in the ground. And I could feel the seething hatred I had for myself. I could feel the terror of being in that coffin, trying to get out. But there was a third part of me that was witnessing it.
Mm-hmm.
In the most unshakable calm, like I was looking at it through a thick pane glass. Like, what the hell?
No, that's.
Do you know what I'm saying?
Yeah,
So like I was three things at the same time, but as the observer, I was completely calm, just completely calm. And so I never experienced a vision that was overwhelming. It was painful.
Yeah.
But that pain led to healing.
Yeah.
So to me, it was like completely worth it. I just don't want to talk about it in a way that's going to be scary. Oh my God, I don't want to go through that. Because it's not like that. It's not.
Right. And I think that's really important, because there can be challenging, and I like that word challenging, because it's not like we're not putting a value on it, like in terms of like positive or negative. When there can be moments during treatments that are harder or challenging to get through, but that's how growth happens in any part of our lives. We don't like get to where we want to be without some growth and some challenges.
Right.
What we believe is happening with psychedelics and ketamine is that it's called expanding the window of tolerance when experiences like that are happening. So we might interact with some memories that could be either like trauma, like reminiscent of like trauma or pain from the past, or other like kind of like more like metaphorical type imagery that's like shedding light on something that's really important. I really believe like these things are like meant to be paid attention to, and they're not just like kind of like random things that are popping up. But we're able to interact with them because we have all of this neuroplasticity that's been built from the ketamine that allows us to tolerate them and to process those experiences differently than we would if we were not having, if the ketamine wasn't on board and we didn't have that neuroplasticity. Whereas like maybe something like that imagery or that memory, the trauma, if I wasn't on ketamine, it would really freak me out, or I might just like automatically dissociate and just like could not interact with it. But in this presence of a psychedelic or ketamine, you can like work with it and interact with it. And but you do have to be in a safe place to do that. So that's why we do spend a lot of time like prepping people for treatments here. You want to be in a safe environment where you feel like psychologically safe, you feel physically safe. You know you've got a team that could come in and like provide like supportive care, and I mean like from a psychological standpoint, like help remind you where you are if you need, and do some grounding if needed. But most people, if they feel safe and trust the process going in, they're going to be able to like go and do that kind of like inner work and like interact with some things that are challenging and unexpected that might arise in a way that they just never could before.
Right.
And I think that's very empowering. I think that instills a lot of confidence, and it also like it leads to a lot of like just understanding and interpretations and progress that like just doesn't always happen like in
Right.
regular like psychotherapy, for example.
Here's the thing I have, like, I'm so fascinated by just the visions and also talking to other people who had them. They didn't have them quite as much as I did. And the other thing I really want to make it clear, really clear. My psychedelic visions seem to have a narrative arc to them.
Yes.
Like it went from sort of nightmarish, very challenging to just, I don't want to say neutral, but more like I was getting out of that sort of self-hatred, self-erasure kind of thing. And I was getting into more like the visions were more about compassion and self-compassion. And then towards the end, they were very spiritual. They were very, spiritual is not, that's not like a great word. It's more about like a sense of belonging to the universe, a sense of being one. And I'll just give you like a really quick example, because when I say spirituality, I'm not saying, oh my God, I found God. That's not what I mean. I mean like a sort of ineffable, I think I understand what this means, but like I had this vision of like, I was like a little turtle and I was just swimming. It was a very sweet, thing. And then I disappeared. But there was a knowing in me that I didn't disappear.
Yeah.
I became the water.
Oh, yeah.
Does that make sense? Like, so, and so what I got out of it is that people, things, love, whatever, it doesn't go away. It doesn't go away. It becomes what's around it. And that sense of oneness and unity that I just, so that's why I just want to make sure, like, when I talk about psychedelic visions, it's all over the board. I mean, it's like everything.
Yeah.
And this is my question to you. Why the hell are they always metaphors?
Are they?
Yes. I've had dozens of psychedelic visions, and not one of them was about anything that I ever went through in my life.
I'd say that's pretty common. Like, I don't know if there's an answer to that, but from learning from like all the people I've worked with, it usually is metaphors. It might be just the way like we're wired in like maybe like in America. Like I wonder about like what are psychedelic experiences for people from other cultures. It might like present very differently. There's this concept of ineffability, or like the inability to like describe what someone is experiencing. That happens all the time when I ask someone. You're like the exception because you're so articulate. But a lot of people that I work with, when they finish their first treatment, they're like, I can't describe what just happened. And it might not be because they're not articulate, but it is like so profoundly different of a kind of experience. But that's a very common thing to say.
Thank you for saying that I'm articulate, but I actually felt extremely inarticulate. I had to work to be able to, like, because I would journal and I would
and like kind of
meditate on it, and it
this?
was what the hell was that?
Yeah, but like some cultures have like words and concepts for like kind of these experiences that we're having in like Western culture. So I don't know how much of that is like our culture. I don't know how much of that is just like how the psychedelics work. But I would say it's like very, very common that most people are not watching like a movie of like this traumatic thing that happened in their life. It's more like they have metaphors that come up, or like feelings or emotions, or imagery that reminds them of things. And maybe that's kindness of the brain, because sometimes I think it would be really hard to like, if you had been through something traumatic and you had to like watch this like, actual like imagery of exactly what happened, that would be I don't know how helpful that would be. So maybe there's like a kindness, maybe there's like an innate wisdom in like the treatment in our brains that gives us something that's more useful, that's kinder, that's gentler, that allows us to find something deeper from it. And we are prone to trying to make meaning. I will say I don't know that we have to make meaning of everything that comes up during these treatments, and I try to like give people that space to like not put pressure on themselves to like, well, I saw this like building. I mean, sometimes the treatments are just really bizarre, and they're I don't know. I think we can kind of hold space for like just some wonder about like we might not have answers to all of this yet.
Well, I mean, like my thought about it was that the psychedelic visions as metaphor seems to be universal, so it has to be.
I mean, it's a very common thing that comes up. Yeah.
And the other thing, you remind me of something that you said to me that was really helpful, because a lot of the times, these things, a lot of the times I had imagery that I just couldn't make sense of it.
Yeah.
And I felt like, well, I can't progress until I understand it. And I remember you said to me, you don't need to make meaning to heal. It was something to that effect, that healing does not require for you to make meaning out of something.
Right.
And that you just have to trust the process. It came up for a reason.
Yeah.
You might not need to know the reason.
Right.
Right. And it was such a free, I'm telling you, that was one of the most freeing things you ever said to me.
Wow.
Because it just released me from this idea that if I don't figure out what this is, I can't get better.
Yeah, a lot of people are like, I need to remember every little part of every journey, of every treatment. No, that's a lot of pressure to put on the treatment. It's just not necessary to do that. I think thinking about like overall how the treatment made you feel, or were there themes, or how did you feel it in your body, or was there some moment of the treatment that stood out? Those are the things I think worth holding on to. Integration work takes time, and sometimes if you really ask the people who've been doing this much longer than I have, they'll say it might take years. You might be integrating your psychedelic experiences throughout your life, which honestly I think is really beautiful, and take some of the pressure off too.
Oh, I don't want to hear that it takes years.
You're already there.
I was in remission in 6 weeks.
But
okay,
you got in remission so fast. But isn't like the beauty of like it's like the gift that keeps on giving? And I know that sounds cliche, but like if you have this beautiful experience and you've learned a lot and you've squeezed a lot of the juice out of it, but what if there's more that you just don't know? Like I think just being open to that possibility is very exciting.
Yeah.
And I've seen people that down the road, like they had this treatment, months later, they started putting the pieces together, and then they've been in remission ever since. And sometimes it just takes time. So
I can see that. But I wanted to just say to you how much I appreciate everything that you've done for me, because I think it was like the end of the 6th week that you pronounced me cured.
I think you pronounced
I know I'm just saying it because I know you're going to go, no, I never said cured. But I do remember you saying, okay, we reached remission, now the job is to stay in it.
Yeah.
And that was another thing that really helped me understand that it might feel like a cure. Cure is too strong a word, but I really do feel like I ended my depression.
Yeah, I think you really did.
If I can give one suggestion to any potential patient that you might have, or current patients, is that you can't approach ketamine like you're getting a massage, where you just lay on the table and you let somebody else do the work and get up and think everything is, I wanted that to happen.
I think a lot of people would like for that to happen. Like this thing is going to be done to me, I'm going to get better.
Right.
doesn't work that way. You're right.
Yeah, and I think part of the genius of the ketamine is that it kind of won't let you do that
Right.
because it brings up so much stuff
Right.
that you are kind of have to
Yeah.
forced to deal
Yeah.
with it. But I do think that that my sense of it is that people who are coming to you, and I don't know anything about your business, but I'm just saying from a patient perspective,
Yeah.
my guess is that most people are coming to ketamine after trying SSRIs, where it's so passive.
Right. Right.
Right?
Right.
You're just popping the pill.
Yeah. This is more like
And be done with it.
This is more like more akin to like
Nothing
doing
comes up.
psychotherapy, right? Like in a way, but we're like doing like psychotherapy with a catalyst for change. But it's more than that too. And I think that's the beauty of ketamine is that, and psychedelics in general, is that you're not a passive participant, but that's good because you should be the driver of your own life and your own healing, and that is very empowering. It gives like people more self-confidence, especially with a condition where we're typically like really bombarded with all this like negative self-appraisal, this negative talk, to actually be like, I'm driving this car, I'm getting myself better, I'm making these connections, I'm healing my life. I mean, that's so empowering. And then there's these tools and realization and true healing that you have with you for life, and nobody can take that away from you.
Yeah. And to me, I just feel so rooted and grounded, like I don't feel like, oh, I'm happy.
Yeah, there's like peacefulness with it.
Yeah, like I'm at peace. And a lot of I think I was in depression for a long time, but there were certain accelerants and circumstances, and some of them are arguably worse today than they were before. And yet, that's how I knew I was in remission, because I thought, this problem has gotten worse, but I haven't.
Yeah, you're more resilient.
Yeah, like I'm just better equipped to deal with it. So
it's like this calm, quiet inner confidence, this inner compass, this inner healing wisdom gets restored and like are reconnected to, and that is hopefully unflappable given like what's going on in the chaos of the world, and like bring it on,
right.
So we can deal with this.
And it also feels like it's not something that I've said to myself, or it's not something that I've done to myself. I think the ketamine, just putting it all together, both the molecule and what it does to the brain, and and the psychology of it with the therapy and all that. I think you put those things together, and I don't know, it just feels like it just pole vaulted over, typical therapy or SSRIs in a way that almost doesn't make sense, because the model that we have, or the model that I had, is you pop a pill and you manage the symptoms. Yeah. And now, I took ketamine and I ended the depression. So it wasn't about managing, it was about ending. And that is the thing, like, I want people to understand that is a real possibility, a real possibility that you can end this and not manage it.
Right.
And you helped make it possible, so thank you.
It's been like an honor to be a part of your journey. No, but this is just like so precious and like just so fun too to get to talk to you, and thank you for letting me be a part of it, and like giving, like sharing. You've been so generous along the way. Not everybody feels comfortable like sharing with me exactly like how they're feeling and like what's coming up for them, and so I learn so much from when my patients are like more open about that, and hopefully we can keep getting the word out to more people and have more people
Well, it was
start their healing journeys.
generosity. it was selfishness disguised as generosity, because I needed to talk to you. I needed to have the conversations that we had.
Yeah, they were really enlightening for me too. I learned a lot. You made me a better doctor. So thank you. Yeah.
Well, that's the nicest thing.
Yeah, you really did.
Cut.
No,
Cut.
I mean it. I learned the most. That's how I learned the most. I learned the most from my patients. Like, this is like seriously like fun.
Yeah.
Thank you.
Oh my God.
Mm-hmm.
Yeah,
Thank you.
I just
it
love
felt
hearing your
really
journey.
good. It felt really good.
I really mean it. Like I learn the most from my patients. You know, like because especially in this world where there is so much
Like how they lie
variability.
and cheat on their scores.
No, but that's normal. But I mean, so many people have the exact same question of like, now what? Am I going to be able to have access to this treatment that's helped me so much? But you're not doing ketamine treatment anymore, right? Because yeah, and I really think that is possible for a lot of people. But I think it takes people who are more active in their care to be able to get to that point where like they've done the work and they can like really stop the treatment and just do like more of the maintenance things.
Yeah, I mean, I don't rule it out at all.
Yeah, and
It's
there
just-
might be a time in life
yeah.
where you're like, I need a little bit more, but yeah,
But you know,
Yeah.
I'm in a really good place.
I can
So.
tell.